Today we're talking about the passing of Ozzy Osbourne, who died today at the age of 76. Osbourne in 2020 revealed that he was diagnosed with Parkinson's disease. And for those of you who don't know, Parkinson's disease is a neurodegenerative disorder which is characterized by loss or damage of neurons within the basal ganglia of the brain. The basal ganglia is a part of the brain that helps coordinate movement. And typically in patients with Parkinson's disease, we see three classic symptoms. One is a resting tremor, which means tremor when the patient is resting still. The second is bradykinesia, which is slow movement. And the third is what you call cogwheel rigidity. Specifically what that means is that when a patient's limb is gently flexed, when they're passively staying there, they're jerking movements, or what's called cogwheeling, when you try to move the limb. So the other characteristic feature of Parkinson's disease that you commonly see is autonomic instability, meaning instability with blood pressure and with postural movements. And that does play a major role in terms of interactions with other disease, as well as how these patients recover and react to anesthesia. In Osbourne's case specifically, he had a variation of Parkinson's disease that's associated with Parkinson's mutation. Parkinson's mutation is associated with mutation in a gene called the PRKN gene. That is a gene that labels mitochondria that are damaged within the basal ganglia for destruction. So when this gene, when this mutation is present, these mitochondria don't get destroyed properly, and it results in dysfunction within the basal ganglia pathways and leads to Parkinson's. In these cases, Parkinson's may happen earlier, and it also may lead to more severe cases of Parkinson's. And although Parkinson's disease on its own does not necessarily lead to death, it can exacerbate other medical conditions and can lead to shorter lifespan. So our condolences to the family of Ozzy Osbourne, and if you have further questions about Parkinson's disease or any other neurological or neurosurgical condition, remember to use the hashtag AskDrJ.